What's up, vets? Listen up. You trust the VA to take care of you, right? You go in for treatment, you expect to get better. But what if the same system that's supposed to heal you ends up hurting you? Imagine getting the wrong medication. Imagine your records disappearing right before surgery, or being told your appointment never existed. This is not some isolated story, guys. This is happening to real veterans right now. What's up, guys? Welcome back to Military Insider Show. My name is Ray, and today we're gonna talk about when the VA healthcare backfires. Today we're pulling their curtain back on a side of the VA that too many people don't see. The side where system errors, staff shortages, and red tape end up putting veterans at risk. Now, I'll be real, and don't get me wrong, the VA has amazing doctors and staff that really care about you. But the system they work under, that's where everything falls apart. So let's talk about what's really happening behind those clinics' doors and how you can protect yourself. Let's start with some perspective and some context here, okay? The VA health system serves about 9 million veterans across the country. That's massive. That's pretty big. But think about it. When you run a system that large, even a small percentage of mistakes can affect thousands of lives. And that's exactly what's been happening. In 2025, reports from the Washington Post and the Government Accountability Office reveal something really disturbing. Serious patient safety issues tied to VA's new electronic health record system. We're talking about missing medical history, wrong dosage, delayed prescriptions, even canceled appointments that never get re-entered into the system. Some cases were linked to actual death. Can you believe that? Now imagine this, your entire medical file disappearing between systems because of software glitch. That's not just a tech problem, guys. That's life or death situation. And this is not just about the software, it's about communication. VA hospitals struggle to coordinate care between in-house doctors and private providers under the Mission Act. One study found that nearly 70% of private doctors said it's hard to get through to VA staff or update veterans' records. That means your civilian doctor might send important notes about your condition, but they never reach your VA file. The result, misdiagnoses, wrong prescriptions, or a VA provider who has no idea what's really going on with your treatment. Now, let's talk about the staffing, because I know this is something across all the VA clinic, and this is a major issue. VA hospitals across the country are short on doctors, nurses, and mental health professionals. Everybody know that, right? That shortage means longer waits, more burnout to the current employers, and more mistakes. I've spoken to veterans who waited months just to get an MRI or a follow-up appointment. Some gave up and paid out of pocket because they couldn't risk wait any longer. And here's what's worse. When those mistakes happen, getting someone to take responsibility feels impossible. You will get bounced between departments, told to file a complaint, and maybe, just maybe, you'll get callbacks week later, but who knows, right? Meanwhile, your health is the one taking the big hit. The veterans who get hurt most are the ones already dealing with chronic or mental health conditions, PTSD, traumatic brain injury, chronic pain. These aren't one-time treatment. It's funny because on my last video, one of the subscribers dropped a comment below saying that the actual VA system give them more chronic PTSD. I think that was funny. They require consistent care, but if your appointments keep getting canceled or your prescriptions are delayed, it's not just frustrating, it's dangerous. I've heard stories of veterans whose depression got worse after missed therapy sessions, or whose pain spiral because they couldn't get the medication on time. It's heartbreaking, and this is not right, guys. Now, let's talk about what you can do, because sitting back and hoping the system works is not enough. You need to act, and you need to act quickly. Number one, you need to keep your own medical records. Every prescription, every test, every visit, save it. Don't rely on the VA system to have everything correct. You'd be surprised how often things go missing. Number two, double check your appointment and prescriptions. After every visit, confirm that your next one is actually scheduled in the system. Call the pharmacy to verify your refill status. A quick phone call can save weeks of headaches. Number three, if your care gets delayed or denied, document everything: names, dates, time. Write it all down. When you escalate or appeal, that record will make your voice stronger, okay? And finally, don't try to navigate it alone. Contact your veteran service organization or your county's VSO office. They know how to handle these situations, and they can help you file official reports or move your case faster, okay? I'm not saying every VA facility is bad, okay? Don't get me wrong, because I've seen a lot of comments saying that their facility is great, there's 5 stars, and then I've seen other people dropping comments saying that their facilities suck, and it is what it is, okay? I know there's some goods and then there's some bads, but there are great doctors and nurses who truly care about veterans, okay? But the system they're trapped in is broken, and everybody knows that. And it's costing lives, believe it or not. The VA doesn't just need more money or new policies. It needs accountability, real oversight. Because every time a veteran is hurt by a system mistake, trust dies a little more. And once trust is gone, veterans stop showing up for care. And that's when it becomes deadly. We don't want that to happen to all our veterans out there, okay? We need to get this straight. Like I said, don't get me wrong. There's a lot of VA facilities that they are very, very good. We got good doctors, we got good nurses, but we also need to think about the one that don't have that staffing, nurses, doctors in other states, in other locations, because everything is, this is just across the United States. So we need to take care of those veterans as well. Now, if this hit home for you, share it. The only way things change is when people start talking about it. That's why I'm doing this type of videos. Make sure you drop your story below. I want to read you guys all. Make sure you tell me your story with the VA healthcare. I wanna read it. Okay. Make sure you hit that like, you hit that subscribe button. Share this content with another veteran. I really want to get as many veterans as possible so they can get the information they need. Thank you so much for your support. Thank you so much for watching, and we'll see you on the next one. Stay safe.